The Drug Enforcement Administration is a federal agency charged with preventing, detecting, and investigating the diversion of controlled pharmaceuticals and listed chemicals. However, their work doesn't end there. They are an agency committed to supporting the local healthcare community, and they're doing this through the education and increased awareness about drug diversion and the opioid epidemic.
Good morning.
This is the DEA at work. Meeting face-to-face with medical professionals at this Practitioner Diversion Awareness Conference, part of a stepped-up educational outreach to all doctors and practitioners.
We've been out to the American Medical Association, the Retail Pharmacy Conference that was held this year.
A way for those with a badge to demonstrate the commitment to the entire healthcare community.
We all have to work together to reduce the amount of drugs out there on the street that could be diverted so we can end this opioid crisis that much faster.
To help achieve that goal, the Drug Enforcement Administration is working to remove misperceptions.
We have physicians who think that DEA is hiding around the corner waiting till they make a mistake, and then we're going to jump out of the bushes and come get them. That's not what we do.
So what does the DEA do, and what does the DEA not do?
The DEA is doing their part with prevention, detection, enforcement, first and foremost enforcement. But what we don't do is tell the doctors how to prescribe to their patients. We don't get into the practice of medicine.
A big part of this conference is to lay out how the DEA works with its registrants, the manufacturers, wholesalers, doctors, practitioners, and pharmacists. This conference is designed to assist doctors, veterinarians, dentists, physician assistants, and nurse practitioners in identifying and preventing diversion activity.
The ultimate mission is to make communities safe.
And they do that by pursuing the most significant drug traffickers and criminal networks, not the individual physician properly prescribing opioids to a patient. So the scrutiny of doctors is rare.
It really is. The statistics that I've heard are something of 1 in 1,000% of doctors are what DEA looks at. And when you look at it from that perspective, we realize that we're really only looking at the most egregious and the most difficult individuals out there.
For medical professionals like doctors and practitioners, the DEA aims to promote their relationship with them as partners, working together in the fight against opioid trafficking and misuse.
DEA can't do this alone. The practitioners can't do it alone. The community can't do it alone. It's everybody working together. This is the only way that we're going to combat this problem. And people need to be educated. And it starts in that doctor's office.
Kathy Federico is a 30-year veteran of the DEA, and as a supervisory diversion investigator, she is driven to help practitioners understand the roles and responsibilities of the DEA, and she highlights the patient safety issues in dealing with prescription opioids.
And right now we're focusing on the practitioners because those are the ones that are interfacing with the patients, and we need them to be able to understand that they need to educate their patients on opioids and what the dangers are of opioids.
And that's the idea behind initiatives like the DEA 360 strategy.
And what that does is DEA teams up with local community leaders, law enforcement, state and local people out there, and even treatment centers. And we get together, we go out and spread community outreach, educational awareness. One, they know, find where they can find the tools and the resources to know that they're able to follow the Controlled Substances Act and follow the rules and regulations, but know that DEA isn't out to get them.
The DEA in no way wants to stand in the way of the needs of patients and their doctors' medical decisions, and so their success hinges on ensuring public health and safety and making sure doctors can treat their patients without interference. In Nashville, I'm Craig Boswell.